Welcome to my channel, Body Talk. Muscle weakness, fatigue, and muscle injury are only two of the many causes that can cause muscle weakness. However, it can also be a sign of other illnesses or a significant problem with the nervous system. You can find out why you have it and what to do about it by speaking with a healthcare professional. Overview: what is muscle weakness? When muscles aren't as powerful as they should be, it's called muscle weakness. There are numerous causes for it, most of which are common and transient. However, a medical condition may also be indicated by muscle weakness. Depending on the cause, muscle weakness can feel different. You may encounter a deterioration of strength, having trouble doing routine tasks or activities, pain when using the afflicted muscles, stability or balance issues when standing or walking, shaking or trembling. Are there many phases or degrees of severity? The Medical Research Council of the United Kingdom developed a strength scale in the early 1940s, which is used by experts. This scale assesses your arm and leg muscle strength using the following: 0 to 5 grading scheme. Absence of strength or muscle movement, traces of muscle action, such as twitches or flickers, movement of muscles without defying gravity. Movement of muscles acting against gravity. The movement of muscles is resisted by some force. The movement of muscles is resisted by full force. Possible causes. What are the most common causes of muscle weakness? Muscle weakness has several major causes, including the consequences of structure impacts on cells. Conditions and injuries affecting the nervous system. Chronic conditions, the consequences of structure usually. This entails harm to the muscle or a portion of the associated connective tissue. Some examples are as follows: stresses in the muscles, torn or sprained ligaments, broken bones, cellular effects. The muscle cells themselves aren't functioning correctly. Muscular weakness may result. Nervous system conditions and injuries. Muscles rely on nerve signals to tell them when to flex and relax. Without those signals, your muscles may not work together or at all. Chronic diseases. Muscle weakness may result from several chronic illnesses. Numerous of these are inflammatory or autoimmune disorders. Care and treatment. How is muscle weakness treated? Your medical history and the underlying reason of your muscular weakness will determine how you are treated. Here are a few instances of treatments: strengthening through physical treatment, nutritional assistance to supply essential nutrients, rest or immobilization to promote the healing of injured tissues. Sometimes the cause of your muscle weakness has no known cure. Long-term neurological damage following a stroke or spinal cord injury are two examples of it. Is muscle weakness preventable? While many reasons of muscle weakness cannot be avoided, some may. You can lower your chance of developing muscle weakness by doing the following. Get better. Your physical strength can be increased through strength training. Later muscle weakening might be prevented or reversed using that. Recognize your boundaries. Avoid overstretching your muscles to the point of damage. Keep your nervous system safe. When engaging in professional or leisure activities, wear protective gear such as padding or helmets. By doing this, injuries to the brain, spine, and nerves can be avoided. Additionally, injuries from collisions involving moving vehicles can be avoided by using seatbelts. Control long-term ailments. By doing this, certain illnesses may not worsen and result in muscle weakness. Taking medicine for epilepsy to stop seizures is one example of this. When to make a doctor's appointment? When should a physician or other healthcare professional treat this symptom? If muscle weakness persists for more than a few days or begins to disrupt your daily schedule, you should see a doctor. When you experience muscle weakness, you should seek emergency medical attention. Begins abruptly, just has an impact on one side of your body, impacts a single limb, such as an arm or leg, spreads to other parts of your body. Please like and subscribe if you appreciate this video. I appreciate you viewing, and I'll see you in the future video.